Hi everybody, Dr. Michael Miyazaki again, bringing some information about the RE-GEN Bioactive EndoPutty. So I just want to go through some of the indications of when to use it, how to use it, and we have a video by Dr. Brett Gilbert who explains how he sees the value in this product. So RE-GEN Bioactive EndoPutty, from an endodontic standpoint, reduces the treatment steps. It's ready to go. You just syringe it out, you can mold it, and you can place it in areas where you have to do root repairs or maybe even indirect or direct pulp capping. So it really helps your patients. And because of its radiopacity, you can keep an eye on it as the patient continues to heal. The RE-GEN Bioactive EndoPutty is a hydraulic, ready-to-use, injectable bioceramic bioactive root repair paste. And it's packaged in an ergonomic syringe just so you can extrude it and it's ready to go. What we recommend is you keep it in the foil pouch so that it doesn't set prematurely. Indications for use for the RE-GEN Bioactive Putty: repair of root perforations, repair of root resorption, root and fillings like retrograde fillings, apexifications on teeth as they develop, and as I mentioned before, pulp capping. The composition of the RE-GEN Bioactive EndoPutty is very similar to Vista Apex's RE-GEN Bioactive EndoSealer. It contains bioglass, calcium aluminate, and zirconium oxide. So it helps the tooth heal and helps you have better end results. The Bioactive EndoPutty is hydraulic, which means it sets when it's around moisture. And that moisture helps to initiate and complete its setting reaction. The RE-GEN Bioactive EndoPutty contains bioglass that promotes remineralization of hydroxyapatite through calcium and phosphate ion release. And through the release of these ions and remineralization of dentin within the root canal system, you strengthen the dentin, promoting the longevity of that treated tooth. Hydroxide is released as part of the cement setting process, which gives the sealer an alkaline pH of around 12. And additionally, the bioglass is a buffering agent to help maintain that high pH. So there's less post-op discomfort from the patient and better healing from the body. So what I'd like to do is just show you a video done by Dr. Brett Gilbert, who is an endodontist and an excellent educator. So let me show you this video and then we'll be right back.
So the next product we're going to discuss is the Bioactive EndoPutty. This is a new product that's made of a calcium aluminate type of material that allows us to have a really great handling of a bioactive material for so many different uses in the dental procedure. It can be used for perforation repair. We use it for apical retrofill for surgery. You can use it in resorption situations. If you ever have a pulp exposure, it's wonderful. It's wonderful for vital pulp therapy. And so there are a number of these on the market. The RE-GEN product is newer and it has a setting time of about 60 minutes. The cost per gram is quite low compared to the others on the market, but what I love about it is the handling. It has a different property in handling that allows me to keep that consistent shape of a little cone for longer. So let's take a look at the packaging here. When I pull it out, there's a little air-sealed packet. And it's really important to remember that you want to store the tube in this packet because humidity can impact the material. So I'm going to go ahead and open it up here, and you'll see that inside you've got a nice syringe. And again, it says Bioactive EndoPutty. And so what I wanted to show you is just, again, you can unscrew it here and just take a little bit just to kind of get a sense of it. It has a nice form to it, as you can see. And so when I break it off, you can see that it doesn't liquefy. And if I roll it into my fingers, I can create little cones. For instance, as you're seeing here for the apical surgery, I'm able to place this directly into the crypt. I can place this on top of pulp tissue, perforation repair, etc. So again, calcium aluminate type material, bioactive, and allows the doctor to have a really biocompatible material that the biologic tissues of either the PDL or the pulp or the periapical area will tolerate. And not only tolerate, but actually really enjoy. Because again, the alkalinity of it is very favorable and the cells will grow right up against it. So Bioactive EndoPutty, extremely valuable to have for trauma cases, for pediatric cases, any type of surgical application, and something that I believe all dentists should have in their office. And I believe Vista Apex has brought to the market something very affordable, very easy to handle with really great performance. So check out the Bioactive EndoPutty.
So again, the RE-GEN Bioactive Putty, key benefits, it's ready to use. It stays in place, it sets fast, has the antibacterial properties because it has a very alkaline pH, and it's moldable and versatile in many situations, whether it's a pulp cap or a root repair. I hope this information helps you to understand what was behind the development of this RE-GEN Bioactive Putty from Vista Apex Solutions. Now, I hope you like this information, and if you do, hit the like button. And if you want to make sure you don't miss out on any other information, and we're going to have some great additional speakers coming up in the future, hit the subscribe button. Again, we're trying to develop a community of like-minded colleagues trying to do the very best for their patients. And we just love it, and we just enjoy sharing information with you to that end. Thank you very much.